The World Health Organization figures more than 125 million girls and women alive today have been cut in the 29 countries in Africa and Middle East where female circumcision is concentrated. The 2008 Nigeria Demographic Health Survey found that 30% of women surveyed aged 15 to 49 years have undergone female genital mutilation. Nigeria in the last decade recognized the practice as harmful to children and women and have embarked on corrective measures. But this, according to my guest, is not enough. The coordinator of Child Health Advocacy Initiative, Mrs. Lola Alonga, says legislation against female genital mutilation will help reduce the prevalence of a practice that is not just a violation of human rights, but detrimental. Thank you so much for your time.
Thank you, my pleasure being here.
We are talking about FGM. Tell us, what really is female genital mutilation?
Yeah, female genital mutilation is referred to as female circumcision. It is also referred to as female genital cutting. It's a procedure that is intentionally done to alter the female genitals for non-medical reasons, and obviously causes injury to the female genital. We have like 4 types. The first one is clitorectomy, which is like when the clitoris is actually totally or partially removed. And they have the type 2, which is when the lips, they call it labia minora, surrounding the clitoris is actually removed along with the clitoris. The clitoris is the sensitive, erectile, small part of the female genital organ. Then you have the type 3, which is called infibulation. That's actually the total sealing up of the female genital covering. And then the type 4 is the one that causes maybe any other type of injury to the genital in the area of piercing or cutting. The way it is, it's actually done more in Africa. It causes a lot of injury to the woman, psychologically, socially. Obviously, it is done most times in Africa for non-medical reasons, which is more of culture and tradition, and obviously done by untrained health workers, and that is why most times they use on sterilized objects, and it causes a lot of infection. It causes a lot of bleeding, and a lot of women die in the process. It also causes obstruction during delivery. Apart from the psychological harm, most times they don't even use any sort of anesthetic to even reduce the pain. And that's like a complete violation of the rights of women. They do not need to be subjected to that.
Why do you think the World Health Organization is raising attention about this in Africa? And of course, Nigeria is part of Africa.
We're looking at a situation where there's a lot of focus on the rights of women now. And globally, it's been an issue which is being tackled, and in most of the advanced countries, there are laws in place, and they are doing quite a lot to sensitize mostly the immigrants, because it's like more predominant in Africa, and mostly, for example, in Nigeria, for example, it's like that's the root. So if we're tackling, if WHO is tackling this worldwide, they need to trace the root and get it solved at the root, and that is why the focus is on Africa and also on Nigeria. In Nigeria, we're silent about it. There is no law in place, and it's like, well, it's a culture, it's a tradition, and the maternal death and the child mortality, it's so high as a result, because during childbirth, a lot of women die, a lot of babies die, and then the women go through a lot of even psychological trauma. Like I said, for example, the infibulation, where they actually seal up, the young females find it very difficult to even urinate. They have a lot of pains. And then why do you subject somebody to all this for no reason, I would say, and obviously for no medical reasons, just in the name of tradition, in the name of culture. Some even say it's some form of honor. Some say it makes the lady marriageable. Some say even they have myths like it's going to eradicate HIV/AIDS, and all this is not true. It's not been proven to work in any way. But at least the bottom line for the African man is that it's going to make my wife less promiscuous, which is a real fundamental abuse, I must say, for the woman, because it's not been proven that those who have gone through it are less promiscuous. So why do you have to say that it's a way of checking your woman to make sure she doesn't go out to do anything without your knowledge? And if you seal it up, or whatever, then that's unfair to women out there. It's a fundamental abuse or violation of the rights of women.
So would you say people, especially those in the rural areas, are aware about the dangers of FGM?
Yeah, I must say they are aware, but they are handicapped because there's no law in place, and then they feel it's a culture, it's a tradition. For example, 40% of Nigerians, according to the statistics by WHO, have been circumcised. 40% of Nigerians have been circumcised. It's predominant in Ekiti, in Edo, in Kwara, and it's like it's what is traditional and has to be done. So a situation where they even know the dangers, they know a lot of things that will come out of it. They know that at times the women die, or the women bleed, and all sorts. But because it's just a tradition according to them. But I think times are changing. Women are liberated now. Women do not have to go to such crude acts unnecessarily for non-medical reasons. And that's why there is the need to protect them, because some are even like harmless. A situation where you want to even protest that, okay, I don't want my child to go through this, but there's nobody to protect you. So if there's a law in place like they have in all advanced countries out there, the woman can speak out and she knows, well, they know she can go to court, they know she can defend herself. And for that reason, there's going to be a decrease. A lot of women are not going to be subject to FGM again.
So is it about having the law in place or having more people who are more enlightened about these dangers and what, the implications?
The law is to protect them. The danger, a lot of them are aware of it. But like I said, there's so many things that culture and tradition has done to women, and they just live with it, and we are like living dead. I'm sorry to use that word, because they don't have any form of protection. And that's why at times they don't even know the effect, but at times, in those days, it's either witches, they just attribute it to something else instead of facing the fact and the issue. So they are aware. A lot of cases, infection do come up, bleeding do come up, obstruction during labor comes up. A lot of harm is being done to the woman. A lot of them even die in the process. They are aware. They are just, they're handicapped. Nobody's talking about it. We have a lot of funny traditions, and it's like they're just living with it. And that is why when a law is in place, the woman is protected. The woman can speak out. The woman can defend herself. The woman can say no. And then there's going to be a decrease in Africa, and globally, WHO will be able to achieve more in reducing female genital mutilation.
So when the law is in place, what about enforcement? This genital mutilation, female genital mutilation, it will be behind the doors and in some remote places.
Yeah, that's true. But like I said, there's a lot of, we're talking about girl education now. We're moving forward. How will this be enforced? When a girl child is educated, when a girl child will be able to make better health decisions, a girl child will be able to know her rights, a girl child will be able to know this is could lead to death. This could lead to, that's why the global campaign, which I'm happy other countries are joining the forces. We're talking about the Safe School Initiative and other forms of support for the girl child. The campaign is there. When every girl child is educated, even if it's up to the primary level, to some extent, they would know their right. To some extent, they can speak out. To some extent, they can protect themselves. They can make better health decisions. Like you have said, it's done at the back. This back now, the girls, they are going to be educated in the rural areas. And that will make them more enlightened to be able to speak out, especially when there is a law in place. So to enforce the law is going to be easy because they would know their right and they will be able to speak out.
Talking about enlightenment and continuous enlightenment, who should be doing this?
Well, I think it's a joint effort by all stakeholders, and I think that is why Child Advocacy, my organization, is also on the campaign, and I want to believe other organizations out there should be able to join the campaign. It's a global issue now, and I think Nigeria, that is where it's really, really happening, should be able to join the campaign and see how we can solve it and solve the problem from the root, and not even trying to solve it over there from the immigrants there. This is where it is happening. We should be able to solve it at this level. And with more sensitization, more awareness campaign, mobilization, more advocacy, especially to the key decision makers of this community, who are the ones like, this is a traditional right that has to be done. The traditional rulers, the community leaders, the government themselves, the women, the market women, the women groups, This is like, do you want your children to die? Do you want them to bleed to death? Do you have to go through this? Is it necessary? It's like bringing them to a round table and let them all see the dangers behind it and why it should be eradicated. It's not like it's a tradition that should go on. No, traditions in Africa that are not useful, that are not beneficial, that are for non-medical reasons should be stopped. And women should be protected. There is a vanguard of campaign for the girl child for women protection now, and I think FGM should be part of the issues where women should be protected, women should be defended.
Thank you so much for your time.
Thank you, my pleasure being here.